Good day. Today we're presenting about novel biodegradable microsphere loaded with samarium and doxorubicin for chemo-radioembolization therapy of liver cancer. Hepatocellular carcinoma, HCC, and liver metastasis is the sixth common diagnosed cancer and the fourth lead in cancer death worldwide. There are limited treatments available for intermediate and advanced stages of liver cancer, as well as this is due to late diagnosis because signs and symptoms of liver cancer is only observed in patients at later stages. There are current treatment strategies for intermediate advanced HCC, which are chemoembolization and radioembolization, which are established and promising treatments for locally advanced solid tumors. Chemoembolization is the injection of the chemotherapeutic drug followed by embolizing agent. The embolizing agent's job is to cut off the blood supply towards the tumor. Radioembolization is a radioactive agent carried by a resin or a glass bead and blockage of the blood supply. These two forms of treatment are administered through transarterial, through the femoral artery towards the liver, towards the tumor. The current therapy, chemoembolization and radioembolization, which is an embolizing microsphere to cut off the blood supply, carrying either the chemo drug or the radioactive isotope. The aim of our study is to combine these two forms of therapy into one delivery system, in which we have the embolizing microsphere to cut off the blood supply towards the tumor, the radioactive isotope, which kills the tumor cells via radiation, and chemotherapeutics, in which is the chemotherapy drugs to kill the tumor cells through cytotoxicity. We are also aiming to use a radioactive isotope, which emits both beta and gamma. Beta for killing the tumor cells and the gamma for imaging purposes for monitoring of our microspheres. Both chemotherapy and radiotherapy in sequence have shown encouraging results in liver cancer patients in different clinical studies. A clinical study done in 2016 has shown that Y90 resin microspheres with chemotherapy has a significant delay in disease progression. Even before that, in 2010, another clinical study has shown that fluorouracil intravenous infusion with Y90 microspheres has an overall survival of 10 months. In our formulation, we use doxorubicin, which is a commonly used chemotherapy drug for solid tumors. And we have radioisotope samarium-153, which is commonly used for palpable treatment of bone cancer, and it's a theranostic radionuclide with beta and gamma emitter. The beta for treatment of tumors, and the gamma for imaging for diagnosis and monitoring. The half-life of samarium is 46.7 hours, and it's produced through thermal nutrient activation, which is locally produced, making it cost-effective. The polymer of choice was PHBV, because it's biodegradable, used for bone scallops, and degradation at 53 weeks. Methodology of producing our AOCMP2021 microspheres is dissolving samarium, doxorubicin, and PHBV in chloroform and using solvent evaporation method to make the microspheres, and the collection of the particles was by centrifugation. Analysis done of the AOCMP2021 microspheres, we used SEM for morphology and size, the FTIR to confirm that the samarium is incorporated in the PHBV, thermal analysis using TGA and DSC, a drug release study in PBS at 37 degrees Celsius, and a cytotoxicity test on HepG2 cell line, liver cancer cell line. As a result, as can be viewed on the image, our AOCMP2021 microspheres were smooth, round, spherical, with a mean diameter of 33.18 micron, making it a suitable size for transarterial administration towards HCC, liver cancer. It's not too small that it will leak off to other organs, as well as not too big that it will block blood supply further away from the tumor. Next, the FTIR results has shown that we have successfully incorporated the samarium into the PHBV, the polymer, with the peaks observed at 1,720 and 1,380. The thermal stability of the AOCMP2021 is up to 155 degrees Celsius with a melting point at 155 degrees Celsius. The samarium content in our AOCMP2021 particles was 12.8%. The radioactivity of AOCMP2021 was 4.2. It is lower than Y90 microspheres. However, we can increase the radioactivity with the samarium dose based on the tumor. The samarium content was 12.8%. The doxorubicin encapsulated was 66%, with a concentration of 1.89 milligram per gram. And the density of our microsphere was 1.75. The in vitro drug release profile shown here, at 430 hours, the cumulative release was 41.5% of doxorubicin from the DoxSMP-HBV. Compared with other doxorubicin-related release studies, this is lower and slower. This is because in this study, we are combining samarium with doxorubicin, as well as the nature of the polymer PHBV. Also, samarium dissolves in organic solvent, forming a composite which encapsulates the doxorubicin, causing it to be in a slower release. Next, the cytotoxicity. We tested the cytotoxicity of the DoxSMP-HBV microsphere using the MTT assay on HepG2 cell line with the viability of the cells. Our highest concentration of 25 microgram per ml of DoxSMP-HBV has shown a cell viability less than 75%, indicating that the DoxSMP-HBV microspheres is toxic towards the HepG2 cells and killing them. As the concentration decreases, the cell viability increases. However, even at the lowest concentration of 3.125 microgram per ml, the cell viability is still less than 100%, indicating that even at a lower concentration of DoxSMP-HBV, it is capable of killing liver cancer cells. This test will be repeated again with a higher concentration after treatment of 24 and 48 hours. In conclusion, we have successfully developed a novel biodegradable chemo-radioembolic microspheres formulation loaded with both samarium, radioactive isotope, and doxorubicin, the chemotherapeutic drug. Our DoxSMP-HBV have demonstrated suitable physiochemical properties as a chemo-radioembolic agent, as well as further studies are needed to evaluate the therapeutic efficiency through animal studies. Thank you very much.